Hi, I'm going to start off by asking a question that you may not be completely comfortable with answering. In the past 3 days, how many obese or overweight people have you seen? Was it a lot as you were walking through? Now, I'm going to start off with another question that you may not be even more comfortable with answering. Do you have family members that are obese? Now, many times you'll see that there's a problem that we actually do not notice on a regular basis, and I'm here to talk about that today. So, hi, my name is Abel Yabut, and today I'll be talking about obesity in the United States. I'm a student here at Harvard College, and although I'm not a completely certified expert, I've done the research based on a myriad of health organizations like the Center for Disease Control and the World Health Organization. So, in this presentation, I'm going to be discussing three main points, which is the effects of obesity in the United States, um, proposing lowering the number of obese people, so a solution to that, and then proposing an action that includes writing to legislatures about providing more nutritious foods to schools and other public institutions in particular. So, at the end, I'll also try to summarize and answer questions. But anyways, why should I consider obesity now? Why is it a problem and why should I even pay attention to it now? Well, first off, we need to consider what obesity really means. And according to the CDC, it's having a BMI of 30 or higher. And according to the World Health Organization as well, it can mean being caused by a variety of effects, including your environment, your psychosocial factors. So what that means is basically like what have other people around you, how they influence you, and then of course genetics. So it's a problem that needs to be talked about more, and it's it's more than just being fat, for lack of a better word. And why is it bad? Well, according to the World Health Organization again, 5 million deaths have been caused worldwide from non-communicable diseases, which means that these diseases cannot be transmitted and usually happens from something else, like obesity, for example. So they've named cardiovascular diseases like diabetes and like heart diseases. Then there's also diabetes, cancer, and a variety of other things that they've mentioned. And this goes to show this also is followed by effects on children as well. It's even worse on children, to where cardiovascular diseases and these other non-communicable diseases are worse for children, according to the World Health Organization. And the extent of this is worldwide, like I mentioned before. And based on this same research paper from the World Health Organization, almost half of adults aged 18 years or over were overweight, and 16% were living with obesity. And this can even affect the entire household to where both there can be both malnourished and overweight people in the household. And then according to a study at Harvard, the most healthy diet patterns cost about $1.50 more per day. And this can add up to a point where you can see that eating healthy is more expensive than eating a lot less healthy, for lack of a better word. So how can we lower these statistics? What is our solution? Well, we want to lower obesity statistics by improving nutrition. And the CDC is already doing this through other programs. And that's what I want to talk about today, according to the CDC, by promoting the implementation of diet nutrition programs. So we want to make food more healthy and more affordable. And one way that our nation's already doing this is with school lunches, specifically the National School Lunch Program. So, according to the United States Department of Agriculture, we can see that they're offering nutritionally balanced, low cost, or free lunches to children each school day. And the reason why these programs can be beneficial to the problem is because there has been research into how these benefit other people. Both the school lunch program and this other program we see here, based on this research from Mand and Flaherty, they have seen improved dietary quality, increased birth weight, and gestation periods for the women in the first program, and then for the school children, reduced childhood obesity, infant mortality, and healthcare costs. So, what is a possible objection to this problem? Well, efforts to change school nutrition may bring rise to limiting individual freedom through stricter school diets. So, what does that mean? Basically, having these programs may lead to less choice and may be a lot more strict on students. But if we choose the right programs, it can be a necessary long-term change to society, and it can have a balance between both choice and health. As we can see, based on a closer look into the National School Lunch Program from the USDA in this research service paper. So, what does our future look like with or without better nutrition? Well, with better nutrition, we can see that people have better cardiovascular health so they can run more and be more active to continue their healthy lifestyle. And we can also have more people with more food and better distribution and better spread of healthy food. If we continue this way, the World Health Organization in the article I mentioned earlier has predicted that global costs of overweight and obesity are predicted to reach 3 trillion per year by 2030 and up to 18 trillion by 2060, which in other words, food will only get more expensive, whether it's healthy or unhealthy. And what can you do to help? Well, like I mentioned before, we can write to legislatures about bringing better food to more institutions. And we can do this by researching into more programs that we can implement into other institutions like local parks, um, hospitals, and even food drives. So we can contact our legislative branch and find the right legislator to implement these programs. And what does this ultimately mean for us? Well, it's more than being overweight, and we need to understand that about obesity. And we do this and solve this by striving to make people healthier and spark a bigger change. Together, we can make the world a healthier place. So, how do you hope to see your family's health in the future? Thank you.